We've got to do better for our patients and our families, and we come to work every day, and the work is give great care. And how can this approach or this way of thinking, help us do that?
The science of care needs to serve primarily the purpose of care, and to do so, it must start with care gaps. What are the things that we're having difficulty doing that will meet the needs of our patients and actually advance their problematic situation? And in understanding those, then generate the research questions. That when that answer comes in, the translation of that evidence into practice will be more natural, and it will be motivated by our need to care, which is what started that cycle to begin with.
So if we implement this strategy about taking out unnecessary rules from policies and guidelines, things that are not evidence-based, it'll leave capacity for evidence-based practice change. The change agents run up against opposition because nurses don't have the capacity to take on one more thing. So subtract before adding. Subtract unnecessary items that are not evidence-based prior to bringing in an evidence-based practice change.
When you know better, you do better, right? So what you've believed all these years wasn't wrong. It's just that we know more now. You haven't done anything wrong, because when you start putting blame on people, that's when they entrench. That's when they say, oh, you're here to tell me that I'm out of sync, that I'm out of step, that I'm doing the wrong thing intentionally, that my motivations are bad. No, this is all about relationship building, and then being able to say to someone, now that we know each other, let me tell you something I know. Let me let you in on the big secret, which is this is the best way to treat hypertension and type 2 diabetes or community-acquired pneumonia. And that person goes, oh my gosh, I didn't know. What else can we do?
We've moved from, I don't think EBP is important, back in the early 2000s, to, most clinicians are saying, I think it's important, I just don't know how to do it, and we can't figure out how to make it happen here. So my opportunity was, I can teach you what it is, and I can help you get it done.
There's a very obvious mismatch between how we've designed the system and what public health really requires. And so recognizing that, to me, is one emblematic example of where we've designed a thing that we think serves a purpose, but there are multiple examples where there really is a mismatch. And I think where EBP comes in is to say, that's the care gap. What's the evidence? And how do we modify the system so that we're actually matching the patient needs with what the system can provide? And I think that's where the evidence-based practice movement, if I can use that term, really will be a key part of transforming healthcare into the 21st century.